Nina Feldman joins me now. Nina covers health for WHYY. Nina, thank you for being here.
Hi, Shirley. Thanks for having me.
So let's talk about the rapid antigen tests. And I keep hearing that the rapid tests can't detect Omicron. So are they effective?
It's important to debunk that rapid tests can't detect Omicron. They can. But what we are seeing is that they're a little bit slower at times at detecting that initial infection. What the researchers I talked to said is that you might be more likely to pick up Omicron a couple of days after you've been infected, and maybe even a couple of days after you've developed symptoms. So that might be why we're hearing sort of anecdotal reports of people with symptoms that are still testing negative. And that's not because Omicron is sort of particularly sneaky or better at evading the technology of the tests. It's because Omicron, as opposed to the previous variants, is more likely to be replicating at the back of the throat, as opposed to in the nasal passage.
And that makes a lot of sense because one of the newer symptoms for Omicron was a sore throat.
Exactly.
The best advice in that situation is isolate as if you have COVID, but test yourself maybe a couple of days after you develop symptoms.
If you get a negative result and you have symptoms, one thing you could try is that some experts are recommending is swabbing the back of your throat. Now, I want to be very careful and say that that process is not authorized or recommended by the FDA. It is authorized and recommended by the regulatory agencies in the UK and in other parts of Europe.
This particular story about the rapid test accuracy hits home for you.
I had a lot of time to think about all of these questions as I was isolating at home with COVID. And I was confused because I had tested negative twice in the days leading up to my positive test. I had symptoms, very minor ones, cold-like symptoms. Tested once with a rapid test, came back negative, felt pretty confident that I just had a cold. Tested again, and my test came back negative. So then I took a third test, and lo and behold, it came back positive. This is a great example, actually, of how rapid tests can work if used sequentially. This positive test result did prevent me from infecting everybody at Christmas dinner. Rapid tests are actually designed to be used sequentially. That's why often they come two in a box, is because you're supposed to use them, a couple of days in a row, especially because that window when you would be able to detect the virus is sort of limited. So maybe you take one the first day and you don't have a high enough viral load for the test to be able to detect it. And so you take the second one the second day, and there's that faint line that you see on the test showing that indeed you are infected.
If you were just exposed, what should you do? Should you be taking that test that very day you were told you had a COVID exposure?
The problem with taking a test right away is that it's almost certainly going to come back negative if you were exposed that very same day. And so it might give you a false sense of confidence if you get a negative test, if you haven't waited for the incubation period. For Delta, the incubation period was about 5 days. Scientists are estimating it's probably a little bit quicker for Omicron, so maybe 3 to 5 days. They recommend you taking the test after the virus would have had time to replicate. Otherwise, it won't pick it up early enough.
We can have confidence in them, but you might need to do a test every day for a few days if you're having symptoms.
I think that is the way that you could feel the most confident in their results. And the question of whether that's realistic because of the availability and cost of these tests is another issue. They're imperfect tools. They're screeners. They're a public health tool that are being used to reduce transmission.
Nina Feldman, thank you so much for your time and for sharing what you learned in your coverage.
Thanks for having me. This is fun.
Hi, I'm Shirley Min.
And I'm Regina Mitchell. For more videos like this, subscribe to WHYY.